We asked Sarah Bone to join us, Research Fellow with the Public Policy Institute of California. Welcome, Ms. Bone. We appreciate your being here.
Thank you for having me, and apologies in advance for this voice. I'll do my best to make sure that you can hear me clearly.
Very Lauren Bacall. We like it. It's all right.
It sounds better than it feels. My name is Sarah Bone. I'm an economist and research fellow at the Public Policy Institute of California. And hopefully many of you are familiar with PPIC, but for those who are not, we are a nonpartisan, independent research institute focused on major policy issues in the state. And I've been asked today to discuss new measures of poverty in California to help set the context for your decisions. The latest official poverty estimates suggest that about 16% of Californians are poor, and as many as 22% of the children in our state are poor. These official poverty statistics are based on a very simple formula that was developed in the early 1960s. It has been useful for tracking trends in poverty over time, and especially for determining eligibility for many safety net programs. However, these statistics have failed to keep up with sweeping changes that have faced our families in the last 5 decades. In particular, official poverty statistics do not reflect the growing cost of living or the cost of medical out-of-pocket expenses, among other factors, nor do official statistics account for changes in public policy targeting low-income people, and importantly, those related to the war on poverty, which Senator Leno mentioned earlier today, is having its 50th year anniversary. So with those shortcomings in mind, researchers since at least the 1990s have been developing alternative measures of poverty. And these efforts culminated in the release of the Census Bureau's Research Supplemental Poverty Measure in 2012. It's referred to as supplemental because it is intended to supplement, not to replace, official poverty statistics. And it's also referred to as research because it's a work in progress and is continuing to be refined. And it's that effort to refine these measures that we at PPIC, as well as some colleagues and co-authors at the Stanford Center on Poverty and Inequality, are now engaged in. And we released what we call the California Poverty Measure in October of last year. Our California Poverty Measure uses basically the same methodology as the Census Bureau Supplemental Poverty Research Measure, but we make a few refinements that we think make it more accurate for California. And we also are able to provide a much more detailed picture. The Census Bureau estimate for California is just one single poverty rate that's an average over 3 years. And as you'll see, our measure goes into much more detail in the variation across our state. So in a nutshell, our measure and the census measure, we think, are more accurate and comprehensive estimates of real economic need. And we make a variety of changes to official poverty measurement, which can be summarized in these 3 main categories. First, we have a more comprehensive estimate of the resources that families actually have to make ends meet, to meet basic needs like clothing, shelter, utilities, and housing, and food. And that includes in-kind benefits like CalFresh, as well as tax programs like the Earned Income Tax Credit and housing subsidies. Second, we account for non-discretionary expenses that are faced by families and affect their disposable income. And these are in major categories like medical out-of-pocket expenses and work expenses, the big one there being child care costs. And finally, our measure judges these net family resources against a more up-to-date estimate of what it actually takes to maintain a basic standard of living in the state. Importantly, it takes account of geographic variation in housing costs, whereas the official poverty measure, the thresholds are the same regardless if you live in California or in Mississippi or anywhere else. And our measure, the California Poverty Measure, finds that about 22% of Californians are poor in 2011. That's about 2 million more than are considered poor under the official poverty measure for the same period. And just to give you a sense of what this means, for a family of 4, the threshold of resources a family would need to be considered above poverty would be about, on average, $28,000 for the state of across the state of California. These higher poverty rates under the California Poverty Measure are coming from the combination of changes that we've implemented in our measure. And they're moving pieces that go in different directions. So the additional resources from safety net programs like CalFresh or the Earned Income Tax Credit would tend to push poverty down, whereas medical out-of-pocket expenses, housing costs would tend to push it up. And on balance, across the state, these net out to being pushing the poverty rate up for the state. However, that's not true in all places across the state. And as you can see, it's not quite true when you look at different age groups. So for children, our poverty rate is about 25%. It's staggeringly high, of course, but it's not as much, it's not as different from the official rate as when you look at all people in California. And that's because of the role that safety net program resources are playing in families with children. And I'll show you that in the following way. So we recalculate our California poverty measure, omitting the cash equivalent benefits that the CalFresh program affords people in California. And under that calculation, you can see that an additional about 4% of children in California would be considered poor were their families to not have these CalFresh benefits. That's about a 29% poverty rate. And I think it's worth noting that this impact of CalFresh on poverty is almost double the impact that we measure from CalWORKs. It looks kind of like a small increment here, but that's about a difference of 400,000 children. And under a similar kind of calculation, we look at what would happen if we excluded all the major safety net programs in our measure. And nearly 40% of children in the state would be considered below poverty, below the poverty threshold of income, if those benefits from major safety net programs were omitted. Under the supplemental poverty measures in our California poverty measure, a higher fraction of California's population is poor than any other state in the U.S. And we do know that a big part of this is coming from housing costs because most Californians, about 70%, live in the most expensive counties in the state. And the resources needed to maintain a basic standard of living, in our estimation, there is about $10,000 more than the official poverty threshold. However, public programs also play an important role. While CalFresh has a sizable impact on family resources, as I showed you, as Ryan mentioned earlier, we have a very low participation rate in the program, which begs the question of what the poverty-reducing effect of CalFresh would be in our measure were we to increase the participation rate in California. And we've begun to look into that a bit more. We find a correlation within California between counties where access is measured to be high, using the access measures from the California Food Policy Advocates, and the extent to which CalFresh reduces poverty in those counties. So the poverty-reducing effect of CalFresh is about 3 times larger in those high-access counties than in low-access ones, which is suggestive evidence that were we to increase the participation rate across the counties in our state or statewide, that we might see even lower rates of poverty under these new, arguably more accurate measures of economic need. And more research is required to fully understand that in a causal framework. But it's clear that this program and other safety net programs in the state play a big role in mitigating poverty among Californians. Thank you.
Thank you, Ms. Bone, for some new information. I had not imagined that our child poverty rate would be as very high as it would be without these programs. I imagine that would put a smile on Lyndon Johnson's face. At the same time, it might horrify him all at the same time, but these programs clearly impact a lot of human suffering. I do have a question. In some of our notes, and it is footnoted, making reference to the CPM and a new look on the social safety net. So I'm either misreading or just missing a point here. It says that an additional 2 million Californians would fall below PPIC's poverty thresholds if CalFresh benefits were not counted. Is that accurate?
An additional, the overall poverty rate in California for all people would be about 2 percentage points higher. I believe that's about 2 million people. I'd have to do the math a little bit faster in my head than I can.
But the reason I ask is then, as you presented and also footnoted, that CalFresh benefits cut child CPM poverty rate by about 4 percentage points and reduce the overall poverty rate by around 800,000 people. So I wasn't sure what the difference was between the 800,000 and the 2 million.
I'm not quite understanding the 800,000 number that you mentioned. Sorry.
That without CalFresh, the overall poverty rate in California would be about 800,000 higher. As you said, it would also raise the child poverty rate by around 380,000.
Right, yes, sorry. So without CalFresh, an additional 800,000 Californians would be considered poor. I think that's correct.
I think so.
And about half of that would be coming from children.
Sure, right. So you're not sure what this 2 million...
I know that the 2 million I have in my head at the moment is the additional Californians considered poor under our measure compared to the official rate.
Okay.
Apologies if there's an error.
In any case, it's a lot of people.
Exactly.
A lot of people. Colleagues, questions for Ms. Bone? Yes, Senator Huff.
So if we're going to quantify or pull into the cost of living in California, and certainly I think we all agree it's a high cost of living, shouldn't we look at why it's such a high cost of living? Because it's ironic that as policymakers, we help drive up the cost of living. If you're going to build a house in Sacramento, you have about $30,000 in fees before you can turn a spade of dirt, so affordable housing becomes difficult to build. We have, as a fuel policy, our own boutique formula that only California has, whereas we could have something similar with other states that would keep the cost down, but instead we're about 40 to 50 cents higher per gallon. We have renewable portfolio standards of renewable energy, and I could go on, but there's a lot of policies we create that drive up the cost. So it's ironically that the policies on the one hand drive up the cost, we turn around and say there's a need for us to supplement on the back end those that it negatively impacts. Well, it negatively impacts everybody, which is one of the reasons our employment rate, there's only 5 states with a higher unemployment rate than California. Even though it's coming down, it's still a terrible thing, and I think we would all agree that a job is the best social program we have going. But it's just ironic, and I guess that's not really a question as much as it is a statement. So you quantified part of that, but as policymakers, we had to look at what we're doing to keep the cost down. Then we wouldn't have to worry about whether or not it's a cost of living in California is higher, and I think that would be the tide that lifts all boats.
Thank you, Senator Huff. I don't know it's so much ironic as it is just reflects the complexity of all of our policymaking, in that if California hadn't taken the lead in cleaning our air and increasing the cost of gasoline so that we can cut some of the emissions, we likely could have air that looks like Beijing's, and the cost of our health care would be that much higher. So it's all a delicate balance of different policy choices. Any other questions for Ms. Bone? If not, we thank you very much, and we hope that you're feeling better soon. Yeah. So we're going to next address participation rates and related recommendations, and we invite Director Will Lightbourne, thank you for being here, and Deputy Director at DSS, Todd Bland, Alexis Fernandez, who is Director of Legislation at California Food Policy Advocates, and Jessica Bartholomew, Legislative Advocate at Western Center on Law and Poverty. Welcome all. Director Lightbourne, shall we start with you?
Yes. Good morning, Chair Leno, Senators, and Happy New Year. I'm Will Lightbourne, the Director of the California Department of Social Services, and as mentioned, we have Deputy Director Todd Bland of the Welfare to Work Division, And we also have Linda Patterson, who is the bureau chief for the food stamp, the CalFresh program in our department. I'd like to make some introductory comments and then turn it over to Mr. Bland to make the substance of our presentation. But to sort of start from where we just ended with Ms. Bone, what we know is that we've got a severe challenge in California of poverty, calculated both by the official rate and by the supplemental rate. And it's particularly a problem of poverty of children. We also know that CalFresh, our SNAP program, is one of the most significant tools available to us to help low-income households meet their basic needs and mitigate the impacts of poverty. To successfully do that, we have to do the following. We have to identify people who may be eligible for the benefit and give them access and an efficient way to apply. We have to accurately determine those applicants who are eligible and then redetermine them on a scheduled basis so that their eligibility remains verified. We have to correctly determine those who are not eligible because of net income, household composition, immigrant status, or possible disqualifying legal circumstances. And at the end of the process, in a situation where, despite our robust eligibility verification systems, when they occur, ineligible individuals obtain benefits, inadvertently or deliberately, we have to identify and resolve those situations. I want to start by saying that access and program integrity are both important agendas, and we're committed to both. To start with access, increasing participation of eligible residents of the state has been one of our uppermost priorities over the past couple of years. We approach that, as Mr. Woolsey observed earlier, with several constraints. First is accurate data. The federal participation numbers are from 2010, and so we're always operating several years beyond their count. The PAI estimates that our colleagues at Food Policy Advocates have developed are a year or two behind where we actually are. So we still have an element of uncertainty there. We know in real time the absolute number of individuals participating in the program receiving benefits, but what we don't know in real time is the number of eligibles. And as the economy improves, for which we're all very grateful, truthfully, the number of eligibles is almost certainly declining. So we're going to have an interaction between those two elements. And then, as Mr. Woolsey mentioned, we're the only state with the SSI-SSP dynamic of the cash-out, cash-in exclusion. And so that excludes about 1 million elderly disabled individuals from participation in the program. And although they are not counted in the base denominator, they are also not counted as aided in the numerator. So the numbers are still imbalanced. And it makes it impossible to sort of do a California to the rest of the country true apples to apples, as Senator Huff was posing. The second constraint we've been dealing with is from the 1990s, in what was perhaps an overabundance of caution. California instituted fingerprinting of applicants. And Public Policy Institute of California's analysis of the CalFresh program suggested to us that that practice had the effect of depressing the number of eligibles, not ineligibles, of eligibles by 6 or 7% of people. That practice was done away with in 2012, but frankly, I think there's still an atmosphere and a taint that goes with the program that it will take us some time to get past.
I think we were the second last state in the country to eliminate that requirement.
I believe that's correct.
And it certainly communicated to people that there was something criminal about
that was the concern,
yeah.
That it made a statement about the intent of the program.
Right.
That was not, I don't think, ever the intention of policymakers, but it's the way it transmitted. And then third, again, as identified both by Mr. Woolsey and by PPIC in their review, states with large immigrant populations tend to have a somewhat depressed participation rate, both because of lingering uncertainty about the question of public assistance and its impact even on legal immigrants for eventual citizenship purposes, as well as the fact that those who are not legally immigrant are not eligible for the program. And so that presents a situation where we know we have several 100,000 child-only CalFresh households in which there's a reasonable assumption that some number of those include adults who would not be eligible themselves, but whose children are as citizens. Those are the constraints. We also have assets that work to our advantage, and we're trying to maximize them. First, because of our county structure, there's the ability to focus local efforts on local conditions, prioritize across that whole range of outreach, inreach, as Mr. Woolsey referred to, looking at other programs that might suggest eligibility or the ability to get there, and verification processes, eligibility processes, and investigations. So the counties have the flexibility to put their priorities where they need to be at any moment. We have strong local partnerships with food bank networks, family resource centers, advocates and outreach contracts, and state-level contracts, as was observed before, that help us do outreach to communities that may be unaware of the benefits of the program. And so we have networks like the 2-on-1 Network, Catholic Charities, food banks, migrant resource centers, et cetera. Another advantage we've had is that in recognition of the exceptional financial conditions that many counties have been facing over this last decade, for a number of years, the legislature and the administration has made it possible for counties that were unable to fully make the county share of the match for administration purposes to at least draw the state available funds to continue their program activities all the way through outreach, eligibility, verification, investigations, et cetera. All of our source systems have developed front-end portals to enable web access for clients or applicants who would otherwise find in-office, face-to-face visits difficult. And finally, counties, advocates, labor unions came together with CDSS to develop a modernization plan that Mr. Bland will comment on. Turning to the program integrity part of our efforts, as with access, it's not readily possible to... Sure.
I'm going to ask if you could hold on the program integrity.
Sure.
It's going to be our next panel, and you're here for that. So we're just going to focus on participation rates at this point and other program details.
So with that, I'll turn it to Mr. Bland unless there's a specific question from
Thank you. Mr. Bland, with regard to error rates, and I understand that with regard to abuse of the program, it gets a little more complicated. The federal government doesn't have an actual...
Are we speaking of, good afternoon, Senator
Yes.
Leno and members. Todd Bland, Deputy Director at the Welfare to Work Division. We're talking about error rate or fraud rate?
I know two different things.
Okay.
Two different things. So start first with the error rate. So the federal government has a threshold
Yes.
that we have to be below.
Correct.
With regard to, and that's a 6%?
Yeah, the federal, essentially, states begin to run afoul of the federal error rate if they are above 6% for 2 consecutive years.
And that would be 6% of those who are applying and
It's-
are
it's
accepted.
I think I'm going to get this right. It would be making a mistake on 6% of the benefit determination amounts and the eligibility determinations
Okay.
that are reviewed.
So it would be both those accepted in the program and that they're getting the right amount.
Yes.
Okay.
And it's a 6% threshold. It was a problem that the state had over a decade ago when we were running afoul and potentially running into penalties in the early part of the last decade. Now our error rate, actually, although 6% is the threshold for penalties, the actual national average is about 3%, and just recently California has actually pushed below that number.
Below
it's been a
3%.
huge effort by the state and by our county partners. We chose to measure it and measure that with counties, and we'll be talking more about participation and how by measuring and using data, that's how you change behavior and you get results.
That's very encouraging. Looking at some information that is on the United States Department of Agriculture's Food and Nutrition Service website, And it says that SNAP's quality control system earns a solid A grade, so this is national. Over 99% of those receiving SNAP benefits are eligible, and payment accuracy was 96.2% in 2011, a historic high. And we're doing at least as well, if not better, you're saying?
I think we were doing reciprocals there. That 96.2 would now be up to essentially 97.
Okay.
I was doing the error rate, the
Yes.
mistake, the
Right.
3%, but yes.
And then the USDA goes on to say that reducing errors saves valuable resources. Payment errors are less than half what they were 10 years ago, which is pretty amazing, which has reduced improper payments nationwide by $3.67 billion in 2011.
Right.
So I think we'd all be pleased if we could say that about all of our state or federal programs. So we're doing possibly something right here.
Absolutely. The improvement in the error rate is something we work with the counties on, and it's definitely huge. It's to their credit and our credit that we've been able to improve over the last decade.
So as low as you are in error and inaccuracy rates, do you have a goal of getting even lower? Do you set goals, I guess, is the first question.
We publish where each county stands on that rate, and they see it. Obviously, the goal is for the eligibility workers to make no mistakes.
Right.
Where we do, as we see counties that have numbers that fluctuate above that average or have problems, we see that in the data. We talk with them. We put them together with potentially peer counties who might have recently made reductions in there. So it's something we monitor. I would say the goal is 0, but it's at the eligibility work. And when we see spikes, we try to work with the counties.
Eligibility and payment accuracy,
I mean,
aside from the fact of human error, do those numbers also include those who may be trying to pull the wool over someone's eyes, or does that fall into the fraud category?
It's accurate determination of benefits. I believe I could have
Of the
Linda comment. The quality,
information
it's the presented information.
Right.
But what we will talk about, and I think you want to defer this more into the program integrity, is that
And we'll get to
that
that.
eligibility function and the work that the eligibility workers do in terms of matches that they run. In some ways, it's difficult to disentangle them. Part of that upfront eligibility and what happens at application has a direct bearing on detection and prevention of fraud.
Right.
And you are correct. That does include client non-reporting, whether intentional or not.
Thank you for that. Senator Hancock.
Yeah, just that triggered another question for me. First of all, I want to congratulate social services for the real progress that you've made, and I think we should be very pleased that we're doing so well in relation to other states in that regard. Unfortunately, with our low participation rate, we're not doing so well. But I was struck. I thought I heard Will Lightbourne say that we make some allowances for counties that decline to pay their administrative share. Are there counties that don't contribute their 15% administrative share?
What we did in several budget years was, because some counties literally were not able to make their matches because of the declining circumstances, was there were allowances made to that they would put up that which they could defer a small amount, and we would not withhold the state share of administrative support.
No, I think that's
Right.
good. My question is, but then since there is only 35%, I guess, or whatever, there's only the state share going to administration, how does that impact the program? Because there's less money. And do you have a list of which counties
Yeah,
couldn't pay and why?
It has not been consistent in every year, but at some points it's been, I think, a total of maybe 30 counties at different points have had to access it. The counties have been very good partners on this and have been, very upfront about trying to maximize their ability. What we have not wanted to do is be in a situation, because of the extended economic situation, budget situation everyone's been in, where local efforts along that whole range of eligibility from first contact to the end start to be impaired because just they can't make the match at that point. And so that was a conscious decision that budget committees and the administration made at the time, that it was important, particularly when we were at this point where we were, and still are, trying to increase the participation rate, that we not truncate the ability to actually do the work on the ground.
I applaud that. I think that's something we need to do, and just in the interest of the people of California who live in those counties. Yeah. I am interested in which counties they are and if they're the same counties over time, just because I've noticed that some counties don't carry their full weight in the state, and I'm interested in what those are. So, but I wondered, again, I was just struck by the fact that there have been counties that don't pay their share of the administrative costs. And I agree, we have to pick up the slack whenever possible.
And if I could just clarify something, because I think it's an important dimension. Because our caseloads have been increasing, the admin processing costs at the local level have been increasing. And so what the situation that has left counties in is, how do they get that work done when their budgets have been in the condition they've been in? And so that was a conscious sort of decision that I think collectively policymakers made, to say we need to keep, to the extent that we can, the work going at the local level, so that we don't wind up depriving people of access, benefits, or accurate determination. Because as Mr. Bland was sort of basically saying, the way our system is built is that we really rely on that front end doing it right. And if that front end does it right, everything that follows is going to be a lot better than if the front end has a margin of error.
Yeah, thank you.
Good point. Senator Bell.
Yes, thank you. Thank you all for your service to our state. And I also am very pleased with the results that we've received. It's an astounding achievement. I'd like to ask kind of an overview question of how many people are poor, how many of those poor people get our supplemental nutrition program, and how many people do not get the supplemental nutrition program that are poor? A simple question. And so we can kind of see what the unmet need is in terms of number of people in a basic way. I think that's kind of what the bottom line for me in terms of setting some goals, kind of getting a good feel for how many poor people that deserve supplemental nutrition program they're eligible can achieve that. And then the other question would be, what is the federal law regarding the poverty rate regarding the supplemental nutrition program? Are we lower than the federal standard that's allowed? How does this information about the new way of analyzing poverty in California relate to this antiquated federal poverty standard, and how many people, if we adjusted the California rate, how many additional people would be covered? So I'm interested in exploring those. Do we need to have a look at that particular issue? Those are the issues I'd like to ask Mr. Chairman. Thank you very much.
Senator Bell, it's a great question. I'll take responsibility myself for interrupting Mr. Bland on his first word. How about if we hear from the rest of the panel on participation? Some of the questions you have may be answered through that process, and then
Thank you, Mr. Chairman.
we'll all come back with questions. So, Mr. Bland, I apologize for cutting you off. If you wanted to add anything, feel free.
Could I clarify one thing,
Sure.
Chair Leno? On the match waiver concept, which you were just talking about, I should have mentioned that the match waiver only applies after counties have met their maintenance of effort requirement of funding, and then it is admin growth above that they can't match, that then we are making allowance for in some cases.
Thank you for that. Okay. Ms. Fernandez.